Welcome everyone to the 12 months progress report. I would like to present my PhD theme, which is management of itching in the treatment of chronic spontaneous urticaria and prurigo nodularis. My name is Andrea Lancz, and I'm a first-year PhD student, and I'm working as an internist in the Department of Internal Medicine of Markusovsky Hospital in Szombathely. I will make my PhD with the help of Department of Dermatology. As you can see, I have a lot of helpers. My vision is that patients with prurigo nodularis or chronic spontaneous urticaria could have a better quality of life. Therefore, my mission is to optimizing the treatment of these diseases. Currently, I have two ongoing projects. The first one is about comparing the safety and efficacy of biologics in prurigo nodularis. It is a systematic review and meta-analysis. Prurigo nodularis is a chronic skin disease that usually presents as multiple, very intensely itching nodules erupting on the extensor surfaces of the extremities and the trunk. It is associated with a significant disease burden, with the majority of patients suffering from depression, anxiety, and sleep disorders. Many associated diseases are known in the background. However, their coexisting or pre-existing condition hasn't been established. Only estimated prevalence is available, but the real number of the patients are probably higher. There are numerous therapeutic options, but the conventional therapy's effectiveness is questionable, and some of the drugs may cause serious adverse events. In recent years, new biological agents have been developed, and in cases where the conventional therapies are ineffective or poorly tolerated, the use of biologics has shown promise. So our aim is to identify the best therapy for prurigo nodularis patients. Our clinical question is, what is the safest and most effective therapy in prurigo nodularis? Using the PICO framework, our populations are patients who are suffering from prurigo nodularis, and we would like to compare the biologics to the conventional therapies. Our hypothesis that biologics are more effective and safer compared to the conventional therapies. We have carried out a systematic search in the three main databases and found almost 5,000 results. And after the selection protocol, we had 134 eligible articles. Here you can see the list of my ongoing and finished analysis. We will analyze a wide range of medicines, and just like the drugs, the articles written about them are very different. It's not an easy task to process such a diverse data, so we are currently working on the overall each result. For now, I would like to present the results for dupilumab, which we are finished. In my first forest plot, I would like to present the effectiveness of dupilumab in case of itch. Our outcome parameters were the itch scales. This scale ranges from 0 to 10. 0 means no itching, and 10 means worst itch imaginable in every kind of itching scale. In the beginning of the studies, the average itch scores of the patients were between 7 to 10, which is very high. We have selected 10 cohort studies for this analysis with 160 patients. And we have compared the baseline itch scores to the follow-up scores, and we have calculated the mean difference. And we have investigated 3 time points. As you can see, after dupilumab treatment, the decrease of the itch scores was more than 5 points. And this is a statistically significant result. And in the studies, more than 4-point decrease was considered significant, so this is also clinically relevant. And I would like to emphasize that the more than 4-point decrease was achieved within 4 weeks. In my second forest plot, I would like to present the improvement of the quality of life. Our outcome parameter was the Dermatology Life Quality Index, which is a questionnaire designed to measure the quality of life of adult patients who are suffering from skin diseases. The higher score means worse quality of life. In this forest plot, I would like to emphasize also the dupilumab. We have analyzed 9 studies with 260 patients, and we have calculated the RAV mean. As you can see, after dupilumab treatment, the overall DLQI decrease was more than 12 points, which is a highly clinically relevant result. In my last forest plot, I would like to present the incidence of adverse events. 8 studies with 8 drugs with more than 700 patients were analyzed, and I would like to highlight that after dupilumab treatment, there were significantly fewer adverse events, which is very important when we are choosing a therapy for a patient. After our results, I would like to show the strengths and limitations. First, I would like to highlight the strengths. It will be the first meta-analysis in this topic. It will be a comprehensive analysis of all existing therapies, and we will investigate a wide range of outcomes. But we have also some limitations as well. First of all, the studies are very heterogeneous, and prurigo nodularis is a relatively rare disease, so the sample sizes are usually small. And there are different definitions of the outcomes. Based on our results so far, our conclusion is that dupilumab is a highly effective therapy for prurigo nodularis. It has a fast onset action, and as the itching reduces, the quality of life improves. We have some suggestion for practice. For example, we suggest that we should use the dupilumab treatment in the earlier phase of this disease. And we have some implications in the research field as well. We need more comparative studies, especially between dupilumab and other biologics. And we need to investigate the long-term effectiveness of dupilumab. Here you can see my progress. Now let me back to my second topic, which is investigating the safety and efficacy of biologics in chronic spontaneous urticaria. Chronic spontaneous urticaria is defined by the presence of urticaria or angioedema or both for a period of 6 weeks or longer. It is a self-limited disorder in most of the cases. However, patients suffering from this have a low quality of life. The estimated point prevalence worldwide is 1%. The first-line therapy for this disease are the second-generation antihistamines, but there are patients who have urticaria refractory to this treatment. In these cases, the use of targeted monoclonal antibodies are necessary. Omalizumab is the first FDA-approved targeted therapy for this disease. Also, omalizumab has been an important addition to the therapeutic armamentum for the management of chronic spontaneous urticaria. There are still a significant percentage of patients who doesn't respond to the combination of omalizumab and antihistamines. With the expanding knowledge of the pathogenesis of this disease, new biological agents are in development, and the preliminary results are promising. So our aim is to find the most effective treatment for chronic spontaneous urticaria. Our clinical question: what is the safest and most effective therapy in chronic spontaneous urticaria? Using the PICO framework, our populations are patients suffering from chronic spontaneous urticaria, and we would like to compare the novel biologics to the conventional therapies. We will observe the efficacy outcomes with the urticaria activity score and the adverse events. Our hypothesis is that novel biologics are more effective and non-inferior in safety compared to the other therapies. Our clinical implication is to achieve the early use of biologics in the treatment of chronic spontaneous urticaria. Our topic is feasible, so our next step will be the Prospero registration. So in summary, these are my 2 ongoing projects, and we are hoping to submit these in the near future. Thank you for your attention, and let me say goodbye with the words of Captain Yemi from Black Clover. Even if you think you might lose, you will be fine as long as you don't give up. Surpass your limits, then a path will open up for you.
Thank you for a nice presentation. You mentioned regarding to your first project and your second forest plot that the 12-point decrease is highly clinically significant result. And I would ask that how many decrease is considered clinically significant? How many points?
There are in these cases that it is a questionnaire with 10 items, and we will question the patients about everything: sexual life, working, how does that affect the skin disease, the clothing, and so on. And the average 4 points considered clinically significant.
Okay, thank you.
I think your conclusion was that DUPI should come first or as early as possible, or I can't remember exactly how you phrased it. The conclusion of the first study.
Earlier phase, yes. In the investigated studies and all the studies and case reports and case series, every patient had a moderate to severe disease. It means that they had a very low quality of life, and they had more than 50 nodules, which is a very horrible, I think. And I'm waiting for the results in case of nodule scores. But in the clinical practice, we see that the nodules decrease are much slower than the each improvement. I think that if we could use the dupilumab in an earlier phase, maybe the healing was faster. Will be faster, sorry.
So you would use this as first-line systemic therapy?
Yes, yes. If I could.
Can you tell me the price of the dupilumab per month, or maybe per year, or anything like that?
If I know correctly, it's $500,000 forint. So it's very pricey. Yes.
Thanks.
What are the experiences with dupilumab in other diseases which
if I know correctly, the atopic dermatitis, the dupilumab is widely used in case of atopic dermatitis, and this was the idea for using in case of prurigo nodularis, because a high percentage of prurigo nodularis patients have also an atopic dermatitis as well. So it could be a background disease in this case.
Thank you.